I got all these sounds going off in the background here because things aren't working exactly the way they're supposed to. Sometimes the technology just fails miserably. Terribly sorry about that. You'd think I'd know what I was doing after a few years, but every now and then things just don't work the way you want them to, and there's new things, and things have been added, and things have changed. And I had been using OBS, but I thought I'd go back to Restream for today, just because I wasn't able to share something with you yesterday that I wanted to, because the way OBS is set up, it's a software platform. It's really not that important to you. So I did want to share with you, yesterday I said I was going to show you the medical regime, because this is part 3 of medical fraud. I wanted to show you the self-guided routine of supplements that the folks that enter into this program are required to take, I guess. So I'm going to put it up on the screen here so you can see it. And it's a lot. It's an awful lot. And honestly, hard to swallow. It's the name of the story. So Jeff Sandoz, Dr. Goodnow, Restorative Health, Supplement Schedule Protocol. And you can see Monday, Tuesday, Wednesday, a cocktail of medications 4 times a day, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday. It just goes on and on and on. And right along the bottom, this is a self-directed program. This protocol may be modified to suit your lifestyle and or preference, which again, you go to a supposed medical facility for medical help, but they're not a medical facility. They don't have doctors on staff. They don't have nurse practitioners on staff. It's an organization designed to separate you from your money at the end of your life. Tell me I'm wrong. I mean, come on, $75,000, $90,000 US for a 3-4 month stay, and promising you that you will get better when you won't. See, hope is a wonderful thing when you have something to live for or have something to hope for. And I'm not trying to sound defeatist or negative here, but when it comes to ALS, there's no hope. You live your life for as long as you can. It is terminal until we have a big breakthrough, the eureka moment when they come up with something that will cure it or at least put it into remission. But right now, the thing is, ALS is an incurable disease. If you get it, just live the best life you can until you can't anymore. It's terminal, always. Anybody who has ever encountered anyone who's had it will tell you the same thing. There is no coming back from this. So this man is selling hope, literally selling it for thousands of dollars. And this whole 3-part series that I've been doing started off when I read about this American woman, Susie Silvestri, and her story exposes the Saskatchewan health regulation as the Wild West, says an expert. This came out on the 30th of November, so this was Sunday when this story came out, and I read about it first thing Monday morning. It came out at 4 a.m. on Sunday. I read about it Monday morning, and I sat there, mouth agape, in shock at what I just read. And I will recite it to you now. American ALS patient died alone after paying $84,000 US in pursuit of healing at controversial Saskatchewan facility. By early December of last year, Susie Silvestri was no longer able to walk or speak. She hadn't eaten for days. The 70-year-old American found herself in the vice grip of her rapidly progressing ALS, a disease that causes gradual loss of muscle control. She was begging doctors at the Moose Jaw, Saskatchewan hospital for a feeding tube, but they said no because her U.S.-based insurance company wouldn't pay the bill. And every single person who was a part of that can go to hell. You denied a feeding tube to a dying woman because her insurance might not pay for it? You have no soul. You clearly have no heart. Damn the torpedoes. When somebody is dying and you can give them some sort of relief, you do it. You don't question whether the insurance company will pay for it. My God, where's your humanity? I was so angry when I read that. I couldn't believe it. How can this be happening in our country? And yet it did. And it has. I'll continue. Starting from that last sentence. She was begging doctors at the Moose Jaw, Saskatchewan hospital for a feeding tube, but they said no because her U.S.-based insurance company wouldn't pay the bill. Nervous and scared, she texted her brother, Chris Silvestri, with her one good hand. This is not what I ever thought my life would look like at this point. Susie had come to Saskatchewan from North Carolina 3 months earlier, chasing the promise of healing offered by Dan Goodenow and his Dr. Goodenow Restorative Health Center in Moose Jaw. It's a private, unregulated facility that claims a 100% success rate in stopping the progression and in restoring function of people with ALS. Well, that's a blatant lie. Goodenow maintains that every person who enrolls in the program offered at the center leaves in better condition than when they entered. In her desperation, Susie put her home up for sale to pay the $84,000 U.S. fee. But former Goodenow employees said that as her condition worsened, Goodenow Center management left Susie to fight for her life on her own. She had to hunt for an American hospital that would install the feeding tube and find a way to get there. One of those workers, who ended up quitting her job at the Goodenow Center as a result of how Susie was treated, concluded these people had been taking advantage of vulnerable clients like Susie. Susie's brother, Charles, agrees with that assessment. I think they just robbed her because they had no way to take care of somebody in her condition, he said. Susie's situation is reminiscent of the stories shared by other Goodenow clients in the CBC story I read to you over the last 2 days. Goodenow has questioned those reports and filed a lawsuit against CBC, claiming its coverage of his program is defamatory. Cute. How much you want to bet he'll try and come after me? I'm just reading a CBC story. In an email to Goodenow and his company, CBC outlined the concerns raised in this story and asked for a comment. In reply, Goodenow's lawyer wrote, "No comment. We don't talk to people we are in active litigation against." At the end of her plight, Susie died alone in a U.S. hospital. Her predicament exposed serious gaps in Saskatchewan's healthcare oversight system as it relates to private businesses like Goodenow's that operate outside of it, according to an expert. Right now, Saskatchewan's the Wild West, said Dan Florizone. I hope I pronounced his name correctly. Dan Florizone, a former Saskatchewan Deputy Minister of Health. We've got to figure out a way to actually contain this. Buyer beware is not the principle by which we want to operate a health system, Florizone said. How could I not be healed? Susie Silvestri's ALS symptoms started to appear in October 2022, making it increasingly difficult for her to do what she loved, hiking and kayaking. She was diagnosed with the disease 1 year later. In her desperate search for healing, she came across the Dr. Goodenow Restorative Health Center. On his YouTube page, Diane Goodenow, the scientist who runs the center, claims stopping the progression of ALS isn't actually that hard. In text messages, Susie told her brother, Charles, Dr. Goodenow has 8 patients in remission. I am number 9, and he is such a sweet man. How could I not be healed? Goodenow says ALS is caused by a deficit in special fats called plasmalogens, and he claims his supplements can fix it through human biochemical engineering. If you actually provide the cells of the human body with the ingredients that they need and then put yourself in an environment that stimulates that adaptability, the body will fix itself, he said on Dr. Amy Novotny's Reawaken Your Health podcast last year. You heard that in the first day when I started to talk about this story. The supplements have not been approved by Health Canada for importation or sale in this country. However, the regulator does allow people, like Goodenow's clients, to bring up to a 3-month supply into Canada for their own personal use. Susie began taking Goodnow supplements at home. The cost was significant, leading her to ask for donations on a GoFundMe page in May 2024. The good news is Goodnow has a 100% success rate with his ALS patients, she told prospective donors on the GoFundMe site. Eventually, I will be hiking in the mountains once again. ALS is widely seen as a death sentence. 80% of ALS patients die within 5 years of diagnosis. There's no known cure, and existing treatments do little to slow down the disease, according to the ALS Society of Canada. But Goodnow insists his program works. Earlier this year, during CBC's investigation of Goodnow's facility, he said, "We do document every single person that comes through our center, okay? They leave that center better than they came in, okay? And that's just simply a fact." Susie, however, ended up leaving the Goodnow Center in a rented ambulance with borrowed medical equipment on her way to an American hospital, with little help from Goodnow or his company. No published scientific evidence. When pressed during an interview earlier this year, Goodnow acknowledged there is no published scientific research that backs up his claims that his program can halt and reverse the progress of ALS. But he says he's working on studies. The chief scientific officer of the ALS Society of Canada, David Taylor, said he has seen no evidence backing Goodnow's claims, and that if such evidence existed, scientists around the globe would be pursuing that research. You have an individual person's hypotheses versus an entire field of people who are spending every moment of every day trying to find that thing that's going to fix the disease, said Taylor. To prove his claims, Goodnow points to the testimony of some clients who say they've improved under his care. While touring the Moose Jaw facility earlier this year, CBC spoke with 65-year-old Scott Myers, who had arrived from Akron, Ohio, just a few weeks prior. He thought Goodnow's program may be helping. Within the first week, I don't know if it was psychosomatic, but I had recovered the last movements that I had lost a couple of weeks prior to that, Myers said. But CBC's investigation found some families who said their loved ones kept getting worse while on the treatment. An $84,000 U.S. bill and a deadline. Eventually, Susie applied to Goodnow's live-in health center in Moose Jaw, believing that would help her get the full benefit of his approach. In late August, she was accepted under a tight deadline. "This invitation is valid for 5 business days," the email said. The Goodnow Center also sent an invoice, $75,000 U.S. for the program and $9,000 U.S. for caregiving service. An additional fee because Susie had high needs and she would be attending the program alone. She needed her briefs changed, help getting in and out of bed, and assistance with feeding. The day she received that invitation, The day she received that invitation, she told Charles, "Looking at selling my home so I can go to a clinic in Canada." Her house didn't sell within the Goodnow deadline, so she found an alternative. She borrowed money because she couldn't sell the house fast, and she told everybody she'd pay them back when she sold the house, said Charles. She was trying like hell. When you've got a death sentence, you're going to try whatever you can. George, her other brother, is one of the people who lent Susie money. He was skeptical of Goodnow's claims, but he also wanted to support his sister. She needed people around her that knew she loved her. She needed people around her that she knew loved her and cared for her and had her best interests in mind, he said. Susie's soaring hope. Because of her advancing ALS, Susie decided to fly from North Carolina to Moose Jaw, spending an additional $20,000 U.S. on a medevac. "I arrived to a room with a view, the delicious smell of wholesome, yummy food, and a super friendly staff," she wrote on her Instagram feed on September 12th. "I am well on my way to recovery." "Watch out for hockey pucks. They move fast and hurt," Charles joked in the text. "Right now, I'm looking out for mooses," Susie replied. Former Goodnow staff member Aldana Curbs said when Susie arrived at the facility, staff members were shocked. "It was our impression, I think, that she required a way higher level of care than we were prepared to give based on our training," said Curbs. But she said Susie was under the impression that she would leave the building walking in 3 months. Curbs, who started with Goodnow Center in June 2024, said she was always baffled by how many clients arrived expecting healing. She would tell them, "That's a wonderful long-term long-term goal for you to have, but I've not seen that in practice over 3 months with every single client that I've seen. I have personally not I personally have not seen that level of recovery. Curb said she asked senior managers why so many people seem to arrive with this belief that they would be healed. We were told that they weren't we were told that they weren't told that and that they were just grasping at straws because that's all they have left, Curbs told CBC. She said management also suggests that clients may have believed they would be healed because they have cognitive issues. After seeing CBC's investigation earlier this year and realizing some clients were told about a 100% success rate, Curbs put in her 2-week notice. I feel for all the people that participated and didn't get what they were promised, she said. It's terrible. This story it just goes from bad to worse. And I can't believe that this shyster is allowed to get away with this. It $75,000, $84,000 she paid, plus another $20,000 to medevacers. $104,000 this woman spent for nothing. There is no cure for ALS. There's nothing that puts it in remission. It's terminal. This man says he can provide a 100% success rate when we all know that is not the case. Saskatchewan, you're better than this. You came up with the idea for universal health care in this country. The greatest Canadian, Tommy Douglas, Kiefer Sutherland's grandfather. Saskatchewan came up with universal health care. Saskatchewan, how are you letting this happen? I'm serious. How are you letting this happen? I mean, you did vote in Mo twice and he killed a woman, so maybe you're just not paying attention. But seriously, get up and do something about this. This simply cannot continue. This is inhumane. It's terrible that anybody would have to go through something like this. And it's allowed to happen. The story is not just heartbreaking and heart-wrenching, but it's really pissed me off. In a country with universal health care, we have a scientist who says he has a cure and has promised a cure, but there is no cure. If there was, if he legitimately could do what he says, I think every single one of us would have heard about this by now. There is no cure for ALS. It is terminal. And he's selling you hope at a time when hope isn't going to help you. And that, my friends, is disgusting. Especially when you consider how much he's selling it to you for. This poor woman spent $104,000 for nothing. I'll be back with part 4 tomorrow to wrap it up and give you some thoughts. Thanks for tuning in, folks. This has been your Grizzly Growl. I'll see you tomorrow.